Good morning. Welcome to the Healthy, Wealthy, and Wise podcast. I'm Dr. William T. Choctaw, and I will be your host this morning. Each month, we strive to provide you, our listeners, with mental, physical, and spiritual strength by giving you actionable advice, information to help you achieve your own personal and professional goals. We appreciate the natural differences that each of you bring to this program, and we're absolutely delighted to have you with us. These podcasts are part of our Leadership Masterclass series, uh, Leadership Medicine Masterclass series, and they're designed to both educate, motivate, and inspire. Today, we have a very excellent topic. We're going to talk about how to stay safe in the heat. How to stay safe in the heat. So if we look around us, we see that daily the planet appears to be getting warmer. Daily, the planet appears to be getting warmer. And so, what I want to do is to give some basic information for educational purposes only, okay? To allow you to understand what may be happening mentally, physically, and spiritually when you're in the heat, and what changes or adjustments you can make to make sure you stay safe. Keep in mind that this is not medical advice. This is just basic educational information. I'm a retired physician, and one of the things that I decided to do with my post retirement time is to help to improve or help to increase education to those around me based on my experiences, both pro and con. Okay. So, as always, we like to put up an outline, and the purpose of the outline is to let you know what we're going to talk about. We're going to talk about heat related injuries. We're going to define it. We're going to specifically talk about heat cramps, heat exhaustion, and heat stroke. We'll talk about how you diagnose them, and specifically, in general, what the best treatment is. Now, we always like to um, uh, sort of put up a more detailed type of outline. And there, what we like to do is to take you more into exactly what we're going to talk about. So stay with us. And here we go. When you think about heat exhaustion, when you think about heat related injuries, period, there are three main categories that they fall into: heat cramps, heat stroke, and heat exhaustion. One of the first symptoms and signs of a heat cramp is usually pain or discomfort in the extremities, most likely the lower extremities. Okay. And so one of the important points that we want to bring home this morning, um, and it's very important to remember this, is that it's important to listen to your body, to listen to your body. And if you remember nothing else that I say today, remember that particular point. Why is that? The body is a very unique and sophisticated, I'm going to call it a human computer. And it has trillions of different signals and connections. And it is very fragile and it is very specific. And it will warn you when there's a problem or potential problem that's about to occur. So whenever you begin to feel uncomfortable, let's say you're out walking in the park, and you've been walking for a while and your legs begin to bother you. Let's say you get leg cramps or something like that. Pay attention to that. Stop. Take a seat, rest a bit, give your legs time to feel better, but don't just push through it and ignore it, because many times these are signs and symptoms that the body is trying to help you to prevent a more serious problem. Now, the reason why all of this is occurring in terms of issues with heat exhaustion and heat stroke, et cetera, is that the reality is that our climate is getting warmer. It is getting warmer. And regardless of which side you are on the political spectrum, the reality is that every year the ice caps are melting more and the temperature continues to increase. For instance, last year there were probably more days of 103 degrees than ever recorded. Okay. And that's because of global warming. So it's important to sort of keep that in mind. So it's not anything that you've done, but basically we have to adjust to what's going on and what's happening around us. So one of the suggestions about in terms of causes of heat stroke and heat exhaustion and cramps is that this usually occurs when the temperature becomes 104 degrees and above. And that's most likely the case. But I'm going to suggest to you that whenever you are aware or have been informed that the temperature is going to be in triple digits, 100 degrees or above, that for you to start beginning to prepare for ways to mitigate and or prevent heat cramps, heat exhaustion, heat stroke. Okay. So yes, they say maybe scientifically it begins at 104. That's when it's definite. But I want you to start thinking about it even sooner. Don't wait until you get to 104 degrees before you start taking measures to mitigate the problem. So what I do and what I um, um, like to suggest is to start at 100 degrees, triple digits. Now, keep in mind, all these are thoughts of mine, and certainly if you have a particular medical problem or you have been informed by your personal physician or your physician to do things differently, please do that. What I am communicating in this podcast is not medical advice. I am basically sharing educational information. But always, 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 if you have a unique medical problem and your physician has informed you that you should do things a certain way, by all means do that. Again, this is not medical advice in this podcast. So there are certain types of people who are very susceptible to heat stroke or to very, very hot temperatures. And as you might surmise, these are individuals who are taking medication, prescription medication, because many times that medication may modify their bodies in a way that they may be more susceptible to when it becomes very, very hot. The very, very young and the very, very old, for obvious reasons. Children and elderly patients or older patients, or older individuals. My, my definition of older individuals is 60 years of age and older. And I know every time I say that, all the 60-year-olds who are listening to me have a fit because they don't consider themselves old. And I agree with them. But for the purposes of this discussion, that's the yardstick that I'm using. And many of them tell me that 60 is the new 40. And I'm sure for them that's true. Obesity is a risk factor. And as you might imagine, many times individuals who have a very, very high BMI or who are obese, many times the body is not able to get rid of heat as effectively as it would if that person were not obese. Sudden temperature changes could be risk factors where you may not be prepared to be in a very, very hot environment, and you need to be aware of that. And very important, times or locations of high humidity. We tend to think about the numbers of the temperature, but most of us don't think about the humidity. And the way to describe humidity, I'm originally from Nashville, Tennessee, and we had very high humidity when I was growing up. And basically, humidity is where you feel like you've been in a shower, where you're just dripping wet. Um, because not only are you hot, but you're hot, you're soggy hot, if that makes any sense. Okay. But my point is the humidity aggravates the heat on the body and it increases the traumatic impact on the body. So keep that in mind as an additional risk factor. So what are some of the signs of individuals who may very well um, have problems um, with heat exhaustion or have problems with increased heat? And first, I'm going to start with um, cramps, heat cramps. Okay. So, one of the first signs that you may have, first indications you may have that your body is becoming too hot, is you may start to get muscle cramps. And the muscle cramps can be anywhere, but many times they may be in the legs or the thighs. And it lets you know that you need to stop and rest. And that's really my bottom line here that once the body gives you a signal that there's a problem or a potential problem, please listen to the body. Okay. There are billions of cells and connections and neurons, and et cetera, et cetera, that are designed by the creator, in my opinion, to keep you safe or to keep us safe. But that's only effective if we pay attention to those signals and acknowledge them and follow them. So, with muscle cramps, what you want to do is stop and rest when you start having cramps. Don't just push through it, stop and rest. Because many times that may be more a matter of the heat than it is of the muscle intrinsically itself. Okay. And so what do you do when you stop? You drink something in addition to resting. You drink some water. Most people will have liquids with them. And I would certainly advise that if you're going to be out in the sun for any significant period of time, that you take some water or some type of liquid with you. But always, always, always pay attention to that sign and to those signs. So heat cramp is the lowest level of, of a heat issue physically that the body may experience. Second level is what we call heat exhaustion. And some signs and symptoms of heat exhaustion include headache, obviously feeling thirsty. You may have excessive sweating. You feel hot, your body has a high temperature. You may become nauseated. The muscle cramps are there and they may be worse. And you may start to feel lethargic. Maybe you just don't have enough energy. You just want to lay down and sleep or whatever. All those may very well be signs of heat exhaustion if indeed you are out in the environment or you are in an environment that may be excessively hot, triple digits and above. Okay. And obviously, what you want to do, rest liquids. And the more liquids you can take in, the better. And then, of course, there's the most serious part of heat related injury is the heat stroke. The heat stroke. And there, you may have rapid breathing, a rapid pulse, because the heart is pumping blood very quickly now, trying to rescue you from this particular situation. Ironically, you may not have a lot of sweating at this stage, at the heat stroke stage. The sweating may stop, but your body temperature is very high. You may be dizzy, your skin is red hot, and you may begin to feel or go unconscious. Obviously, this is an absolute emergency. And if this occurs, if you're able to, you want to call 911, or hopefully someone will call 911 for you. So, what's my point? My point is that heat stroke, heat cramps, and heat exhaustion can be a serious continuum if not treated properly and if not recognized as it should be. Some other basically common sense type situations, um, um, as I'm sure we all agree, under no circumstances should children ever be placed in a car or any enclosed area that might be hot. I don't care whether you roll the windows down or crack the windows, it doesn't matter. Because what we know is that if the temperature outside, let's say you're out walking in a park or something, if that's triple digits, if you're in a closed space, like a house, a room, a car, or something like that, the temperature is much higher. And we'll give you some specifics on that a bit later. So never, 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 never leave children or any live humans or animals in an automobile when it's very hot. And again, what you want to do is hydrate, hydrate, hydrate. So as time goes on, and as one gets hotter and hotter, what will happen is that the body will try to rescue you. Um, but if you don't help the body rescue you, then many times that will be very unsuccessful. And believe it or not, there are more people who die from heat stroke than other weather-related types of catastrophes or problems. And that may very well be a little surprising, but it just gives you an idea of the magnitude, if you will, of the problem. So, in summary, climate change is causing the environment to get warmer. No question about it. And we've all experienced this, regardless of where you live. The various types of heat related damages to the body are heat cramps, heat exhaustion, and heat strokes, with heat strokes understandably being the most serious. When you begin to feel the early stage of a heat cramp, stop all activity, rest, cool yourself, and hydrate. And if that progresses, call 911. If you feel that you're developing a heat stroke or you're with someone and they're developing a heat stroke, call 911 because indeed it could be a very, very serious problem that can end up being the most serious of all. Remember also that outside heat tends to be higher than uh, inside heat tends to be higher than outside heat. Give me an example. And we talked about the car, but let's say the outside temperature is 80 degrees. After 20 minutes, that inside temperature could be up to 109 degrees. Um, um, in 40 minutes, that 80-degree outside temperature can be 118 degrees. And in 60 minutes, that 80-degree outside temperature can be 123 degrees. What's my point? My point is this is a potentially serious problem, and to prevent it from becoming more serious, it's important, very important, to rest, hydrate, cool, and to take care of ourselves. Our goal is always to keep you healthy, wealthy, and wise. Um, and in conclusion, as we always like to say, in the words of Gandhi, be the change that you want to see in the world. Thank you for being with me today. Have a wonderful day.